Welcome to the Honor It All podcast. I'm Honor Garrett, your host, and we're here to honor all that is good in the world. Each podcast, I interview top professionals around the globe who are making a difference, impacting lives and creating positive change. Today, we have Taylorann, registered nurse who graduated from Vanderbilt University, specializing in adult and geriatric medicine. Taylor also focuses on treating obesity, mental health, ADD, ADHD. She also provides life coaching, counseling, and preventative medicine. Taylor took her passion to help others and partnered with John Kinney, a Tallahassee attorney, to create a concierge direct primary care medical clinic. It's called Aquarian. I met Taylor in her clinic because I wanted to check out what this personalized medical care was all about. And Taylor and I instantly clicked because of our shared interest in wellness and our love for learning. But that was just a bonus. What I was truly impressed with is by the level of time and attention that was provided by Taylor and her entire team for every patient. So I'm so honored to have you here today, Taylor, as part of the Honor It All podcast. Welcome. How are you?
Thank you. I am truly honored. Thank you so much for having me on your podcast, Honor.
Well, glad to have you here. And I'm actually really ready to dive in because I want to learn more about you and Aquarian. So tell me a little bit, what's your journey to get here to Aquarian Clinic? Did you always want to be a registered nurse?
Yes. So, well, how long do you have? It's quite a long journey, but I'll try to simplify it. So my mom is a nurse. My dad is an entrepreneur. I'm raised in Tallahassee, Florida. My dad opened a business in Tallahassee when I was 3 years old. My mom went back to school to be a nurse when I was 8 years old. And I remember poring over all of her notes, helping her create note cards, flashcards. That was the time before computers, of course. And we had these piles of books. And so I remember going through the application process to get into nurse practitioner school and realizing I may have been the youngest unofficial nursing student there ever was, and truly seeing my patient and my parents hustle and just loving what they did for the community and realizing that I could also give back. So yes, I've wanted to be a nurse since I can remember.
Well, and obviously it runs in your family. And I know that you have such a desire for learning just in the short time we've known each other and talked, getting so excited just to learn about the body and all that, how you can preventatively take care of yourself and all that. So what was your journey to Aquarian? So you became a registered nurse, but then where did this, creation come from? And tell us a little bit about what is Aquarian.
Sure. So when I started working in medicine, I was 17 years old. I was at a local high school here. My mom was working for a surgeon, and at that point in time, I was buying myself a car and working at a Sonny's barbecue as a vegetarian, funny enough. And so I got the opportunity to start working in her office just by hanging out there after school and kind of weaseled my way into a job and started actually helping them with insurance claims. And I was like, where's all the patients? I want to talk to people. I love people. And I've been in medicine since I was 17. So for over 20 years now, I've watched the system and realized that unfortunately, was fortunate as well. Insurance, I love insurance, but there's so much of the process that is involved with taking care of insurance claims and a lot of paperwork, and identified a lot of barriers in patients' care and realized how can I help eliminate some of these barriers in care? And so throughout the process and working in community health centers as well as surgery in the hospitals, I said, what happens if I don't take insurance in my clinic? And so back in 2018, they passed that direct primary care clinics do not fall under the same rules as insurance. And the reason they did have that in place was we do function a lot like insurance companies. Patients can come in and see us. We truly take care of the whole person. There's less referrals to specialists. We have a pharmacy on site. We have the ability to draw blood work on site. We can contract with the lab companies to discount prices for patients. And so I understand where people would say, hey, you guys are insurance. Well, we're not. We operate outside of the insurance system. And so I realized then by removing insurance from the equation, I truly was able to provide direct primary care to patients. And furthermore, in 2020, they passed that nurse practitioners can practice independently without a physician overseeing them in the primary care setting. And I had been practicing as a nurse practitioner at that point in time for almost a decade, and realized that between the 2018 laws being passed, 2020, and after working in the hospital during COVID, I said, I think this is probably my time to do the thing. And so I worked with John Kinney, as you mentioned. He's a local attorney in town. Told him about the model. I had been opening a yoga studio, and he's going, "Wait, this is so cool. What's the catch?" And I said, "There really isn't a catch. This is just a different way of looking at the healthcare model, the healthcare system." And he got just as passionate as me, which I didn't think was possible. And the two of us, with our like-minded brains, thinking outside the box, we formed Aquarian Clinic just over a year ago.
Now, is there a reason behind the name?
So great question. So a lot of people ask me that. So I have these little notebooks I like to jot ideas down in. And I was working in the hospital at that time as a hospitalist, and I'd written down 1,000 names probably over 6 months, along with a bunch of ideas I had. And one of my best friends in the hospital at that time had been going through a lot, and she was Aquarius, and it was 2 a.m. and we called the witching hour, and something went off in my head, and I said, you know what, there's so much about the sign Aquarius, and I'm actually a Cancer, but still a water sign, and it has to do with innovation, movement, constant change. And it really resonated with me on, this is the way that healthcare should be as well. And so I was able to have a creative name, and it sticks out. People think about, oh, what is that? And they want to know more about it. And so it's a little misleading. People say, oh, you're a fish, or are you a vet? No, I'm not a vet, and I don't take care of fish. But Aquarian truly is a sign for innovation, change, and fluidity, which is something that I want to see in the healthcare system.
Well, that's beautiful. And that also goes
Thanks.
along and resonates with your whole theme of self-care and yoga and that part of your life too. So if someone comes to Aquarian, is yoga part of that? How do you weave that into what you're doing?
Yes, I love that question. So I opened the yoga studio first, and it was, it's something I had never liked to say, oh, it was a terrible time to open a yoga studio, which truthfully, it wasn't a great time to open a yoga studio. But as an entrepreneur and someone so passionate about self-care, I was able to then start this practice and start really looking at the patient's ability to, how do I offer, how do I not just practice, how do I practice what I preach, and how do I not just offer medical services? How can I say, how, when you're saying work on your stress levels, work on exercising. And so with my treatment plans with my patients, I don't force anyone to do yoga. It's one of the things I'm able to recommend patients and have that follow through. Say, hey, listen, I understand you have these stressful things going on in your life. Have you thought about taking a yoga class? And so we actually offer yoga in the clinic after hours. And so the patients it's only $33 extra a month for unlimited yoga. My whole thing with the yoga studio was never to make money. It was to have more people have access to a more medical type approach, more of a treatment than just going to a traditional yoga class. So I was able to truly integrate my passion for yoga, meditation, and wellness into my treatment plans with patients, and offer yoga in the clinic, as well as the prescriptions and everything else. But it really adds to the dynamic care that we offer.
That's amazing. It's like the
Thanks.
holistic just approach to the whole body. And
Yeah.
I just think that's so beautiful, because now more than ever today, we all need to really focus on self-care. And so could you share with our audience your take on self-care, and what does that look like to you, and how do you help your patients?
Yes, I love that question too. So, and it's different for everybody. And this is when, thank you, by the way, for giving me recognition for spending time with my patients, because I truly pride myself in the ability with this model the first appointment's always an hour with the patient. I have a very in-depth intake questionnaire that truly goes through all aspects of life. If you look at lifestyle medicine or functional medicine, we look at all these pillars of what is health, what is wellness. And so what one person is doing to take care of themselves may be different than another person. And none of those things are wrong necessarily. but it depends on the person and it depends on what it is. If I look at the big picture, what is it that they are lacking in their lives that we can supplement? So some people, when I ask the question, how much sleep are you getting? Well, I work night shifts, so I don't really sleep that much. Okay, well, we need to work on that. Are you eating healthy? Well, maybe sometimes, or yeah, I eat great. I eat, all of my colors and this and that. And so that's then I look at something like, what is the big factor? What is the glaring thing in someone's life? Which we love to take the path of least resistance, right? Like, oh, if I eat healthy, everything will be okay. Well, you got to look at sleep. You have to look at people's social lives. Are we getting enough socialization? Are we involved with the community? And so when you look at self care, you really have to look at all these different aspects. And then when you're taking care of a patient, really try to lift them up and help them figure out what is going to enhance their life. And so, for me might be getting more sleep. For them, well, they're getting 8 hours of sleep. I don't encourage them to sleep more. So it truly depends on the patient and looks at all aspects of life and then figuring out what it is that I can do to help you enhance those things that help you make you better, both mentally and physically.
That's what was so impressed with, because when I came, number one, you spent so much time with me, and you were engaging with the things that I wanted to talk about, where I know sometimes I've been frustrated because the doctor will come in, they see you for 5 minutes, then they leave and they go, you're fine. And I've even met with doctors before and said, I want blood work. I want to find out what my levels are. And they said, we don't do that. And I'm like, what do you mean you don't do that? And the doctor said, well, do you have a symptom? Because basically, if you have a symptom, we'll give you medicine for it. And I just couldn't believe that doctor was actually admitting that. That was like, whoa. Because to me, it's all about getting to the root cause and how you can create a better quality, longevity, but also quality of life. So, and for me, at least for me, the meditation part has been huge because, and will you touch on that about mindset? Because I honestly think you can make yourself sick. Your thoughts are so powerful.
Yes, we don't give ourselves enough credit for how powerful our minds are, and that truly everything is integrated. And I love to remind people, I have the cutest guy today. He was in his 60s, and he goes, well, my hip hurts, and then my left knee hurts, and my whole left side hurts. And I go, remember that song where kids and they teach us the hip bone's connected to the right? And so I tell people the head bone's connected to everything. And so it's so important that we don't just brush off the things that our patients are telling us. And it may be something very, very small that they might not think is a big deal. I extracted from one of my patients' intake questionnaires today that I think he might have bipolar disorder, but someone may not have caught that because it was so subtle in what he said, and a couple other things. And I go, oh my gosh, this man's been treated for depression and he has bipolar disorder. And so it's one of those things that if you have the time to spend with the patient, you're not just going to throw medication at them. And it's unfortunate, I think, for the most medical providers, because we do go into it with good intentions, generally speaking.
Absolutely. Yes.
And most people do. And I don't know a doctor that said, I'm just going to be a rich doctor. There are some, I'm sure, but we go in with the good intentions. But as a medical provider working in the traditional system, which works for some people, I think, but it didn't for me because I was seeing 30 patients a day in a community health setting. And even though I wanted to get more information from them, I didn't have the time. So I was that other provider, my hand on the door. I want to hear what they had to say, but I didn't have the time to give them. And it broke my heart because that wasn't how I, as a medical provider, saw, my mom, when I started when I was a kid, being the youngest nursing student, my vision was truly sitting down and helping patients. And so with the time, we are truly able to get more information from the patient. And the patient tells me what they need. It's not me necessarily telling them what they need. It's just sometimes me reflecting back to them saying, hey, this is what I'm hearing you say. Have you thought about that? And going, oh my gosh, how come I didn't think of that? I said, that's what I'm here for.
Well, it does seem, when you look at the whole scope of the medical industry, that a lot of it is sick care, not so much healthcare and preventative care and And I know that most doctors, just like you said, they go into it with great intentions, but they're either their hands are tied or they're so busy they don't even have time to learn about nutrition or read all the new medical journals because they're just too slammed.
Oh, that's so heartbreaking for
And
me.
and so I understand. I'm not saying that, doctors are bad, but it's so nice
No.
that there's an alternative that we can,
Yes.
if we don't get all our answer, can't get all our answers, or we don't feel completely complete in that service, that
Mhm.
there's an alternative. And it's
Mhm.
kind of like a concierge of where you can help people exactly where they are and spend
Right.
time with them. And, what's the range of, I guess, of people age-wise that you're seeing come to the clinic?
Right. We have people all ages, but generally speaking, which is actually interesting you asked that because I specialize in adult and geriatric. So my scope of practice is from 12 years to death. And I would see mostly older patients because I specialize in chronic disease management. And so by the time, what you said earlier, which resonated, I got all excited. It's all about well care instead of sick care. And by that point in time, you're taking care of sick people. And I love taking care of sick people, but I started seeing, I'm going, if someone had talked to them when they were my age, if they were 40 and they had had this conversation with their provider, maybe they wouldn't be here today. And so when you mentioned concierge medicine, yes, we are concierge medicine, but we're not the traditional concierge medicine, which costs thousands of dollars a year because, well, they're paying to get taken care of for these multiple chronic conditions. And so with direct primary care, it is concierge medicine. It still falls under that umbrella of care with concierge medicine, but you're doing more of the prevention. And so I see most people coming in their 20s, which I've loved now. I was terrified of 20-year-olds when I was younger because I didn't know how to take care of them. It's funny enough that you think the complex patients would be scarier, but to me, it was the people that were trying to figure it out. And I didn't know if I knew how to help them. But after studying and talking with them, I have a lot of patients that are really in that preventive stage. So they're in their 20s and they're working through anxiety, depression, stress. I mean, all of us, you can look at the statistics, especially with COVID that have come out, which is great because it's taking some of the stigma out of the mental health world. But I'm seeing most of my patients, I'd say, in their 20s to 50s, probably,
Mhm.
which is incredible because these people are truly wanting to take charge of their health and wanting to have different answers and getting more engaged with their care. And there's a term now that's called patient centered medical care because we do put the responsibility on the patient. Hey, if you want to feel good, I need you to come back in and get your blood work done. And I do place some of that in the patient's hands because they should be responsible for their healthcare. It gives them, they're invested in it at that point in time.
Well,
So,
and yeah, what I try to tell everybody is that, number one, doctors are amazing, nurses are amazing. They're there to help you. They have so much knowledge. But at the end of the day, you are responsible for your own health.
yes, we are now people are, yeah, but we haven't been taught that. We
Yeah.
haven't been taught that culturally. It's been you get sick and a doctor takes care of you. We haven't had the culture of your provider, primary care. That's what that is. Primary care is our job is to take care of the primary parts of your life. And when we have a message, we haven't gotten there, but we have our messaging service that our patients can message us, similar to instant messenger, HIPAA compliant, of course. And I tell patients there's never a stupid question, ever. But you can't call a doctor's office traditionally and say, hey, listen, I have this question I want to ask the doctor because they're going to say, oh, the next appointment's in 3 weeks from now. Or, of course, the doctor can't talk on the phone. They have 40 patients that day. And so I say, there's never a stupid question. If it's about your period, if it's about a weird pain you're having, whatever it is, I want to know about it now. And so that way we have it's something I'm calling continuous care, a continuous care model. So you're truly talking about things as they come up instead of pushing it back, pushing it back. And that's where we see chronic conditions is that we don't necessarily identify something that's going on because it may start really small. And then before we know it, it's exploded into this whole thing or things. And so with a continuous care model, we have the ability to truly talk to our patients as things come up and be a primary resource to them. I love having the ability to be that primary resource and really encouraging a patient. There's never a stupid question. There just isn't.
Well, and that's why I would encourage people that even if you've been to the doctor and they said, oh, you're fine, if you still have this feeling that something's not right, then ask again. And, just like when I told you I had some issues with my eyes, and
Right.
you are able not only to have knowledge, but you also have access to other
Right.
professionals,
Yes.
if there's anything. So what do you like most about the model? I'll tell people though, there is an app. you can text, you can ask questions, you can get in within what, 1 or 2 days when you request?
We typically even do same day appointments. Now that I have another nurse practitioner, a lot of my patients can come in the same day if it's urgent, but next day appointments, I can do televisits with patients, which is just a quick phone call. It doesn't even need to be face to face. It doesn't have to be as formal as Zoom. It can just be a, hey Taylor, I need to talk to you for 5 minutes. I feel like I'm going to blow up on this person and I need some advice. Yes, no problem. I've got 5 minutes in my schedule. I'll call you really quick. Let's walk through this together. So it is definitely the access, I'd say, to answer your question. For my patients to have access to me, and for me to have access to my patients. So say I see you and I was, thinking about our visit today. It's been an hour long and it's 5:30 at night. Instead of, oh yeah, in the next appointment I'll ask this patient, I'm going to get on there and say, hey, listen, I didn't ask you this, and I think this would be an important piece of information. So it's access for the patient, but also for me to the patient as well, which is amazing. Same with like referrals. If a patient needs to be updated on the status of something, we're not playing phone tag. It's, hey, I have our assistant working on this referral for you. I'm going to tag him in this message. And if you have questions on your referral, let us know. And we'll absolutely keep you updated as well. So access is definitely my favorite part of this model.
And that's the key really for anybody looking for something that they feel like they are seen and heard and important. And you guys have that communication, which is, I mean, how many of the listeners out there have ever just said, oh, I just want to text my doctor and he'll get right back to me. So that's what's so exciting. And I wanted to ask you, do you have any, you may not be able to share because I don't know, like compliance, but do you have any success stories or anything that you want to, or just anything you want to share with our audience that has been a highlight about Aquarian, or something that you really pride with what you're doing?
And there's so many. I'm trying to think of, so one program we're working on now, and this is just the first thing that came to my mind. And this is and it's interesting with this model, people go, how do you sell it? You don't sell it, you educate people on it and you tell people success stories. And that's truly, the sale there is the ability to tell people success stories, and it sells itself. And so this patient comes in to see me. And she's actually going to start doing some marketing with us. So she doesn't mind us talking about her. And I won't disclose her name, but she started seeing me through word of mouth, which is how we get most of our patients. Hey, you got to go see this clinic. They're incredible. And just check it out, and we don't have any, you can come see us for a one-time visit. You still pay for a month, which is $89 a month for patients to come in. And if they don't want to stay, they don't have to stay. There's no obligation. I tell people, hey, if this isn't going to work for you, it's not going to work for me either. I'm never going to have to hold you onto a contract that's not going to work, because that's not how we operate. So this woman was referred to us. She's a hairdresser through another hairdresser friend. And she was nearly 400 pounds on Christmas. And she took a picture of herself in front of her Christmas tree. And she looked at it and goes, who's that? And what am I doing? This is not working for me. So she had stopped going to see a medical provider the year before, because everyone told her, you need to lose weight. She goes, yes, I know I need to lose weight. It's obvious, but can you help me, please? Her mental health was suffering because she had stopped her meds. She didn't have insurance. She didn't have access to the medications. She was having issues with her cycle. She was having issues with her thyroid that wasn't controlled. She was pre-diabetic. Cholesterol was elevated. So it has all these myriad of things that I think she's early 40s. And again, these are things that at this point in her life, if we, say, hey, listen, we're at that point where we're still in prevention. I mean, there are some of the things where you can prevent, but other things that we can nip this in the bud. And so, of course, we talked about her weight. That was important to her. She wanted to lose weight, but the focus of the appointment wasn't to tell her, you need to lose weight and then come back to see me. It was, all right, we did the intake questionnaire. These are obviously the things that are most important to you. Let's address these things, and we'll continue to work together, whether that's every other week you need to come in, if you need check-ins, if I need to message you. And she truly used the messaging app to talk about her diet, her nutrition. What can I change? Small changes, nothing like earth-shattering, but she started making small changes. She got the blood work done, which we have very affordable. We draw it in the clinic. I got her on the weight loss medication we're starting to use, and she's lost almost 100 pounds. Her thyroid is under perfect control. She's no longer pre-diabetic. Her cholesterol is under control. Her vitamin
Mhm.
D, vitamin B levels are up, which this is one of the things I tell people. They can be within normal range, but they're not. That's not optimized. We talk about optimizing people. So her success, just watching her growth and the smile on her face and her ability to walk in the clinic with her shoulders back and her jeans baggy and is just, this is why I do what I do. And we have success story after success story, and maybe not as extreme as that with every patient, but watching her every step of the way and being there for her has been one of the most rewarding, is the most rewarding process. That's what it's all about. And
Wow.
so we have, and also it's, mental health disorders, like I said, it's been so stigmatized. And if you are able to approach a medical provider that's willing to talk to you and listen, and you might not need medications. A lot of people don't need meds. They need to be listened to and talk about strategies and how to overcome things, and meditation and yoga and gentle reminders throughout the messaging app if they're, struggling with something, reminding them, hey, I'm here for you and look how far you've come. It's been only been 4 months since we've been working on this. And oh yeah, you're right, it has only been 4 months. We're doing awesome here. So it's truly incredible to see the changes in these patients. And we've only been open a year, and we have between both of our clinics, we have 400 patients. We just opened a clinic in Jacksonville, so we have about 400 patients, and they're all success stories.
That's what I
They
was
really
saying. You
are.
guys obviously were so successful that you opened up another clinic, and you keep continuing to add new services that are specialized to help people. So do you have, what is your grand, like 5 years from now? Do you have any more irons in the fire or some grand plan, or are you just really just loving what you're doing right now?
I love what I'm doing now, and it's so funny you say that. I had a patient today who, she just signed her daughter up. So she brought her 18-year-old daughter in, which is it's perfect for these college kids, because they, even if they're going away to college, this one's doing a study abroad in Hawaii for a couple weeks, and her mom wanted to make sure she was established with me. So if she is in Hawaii and something happens, she can message me, and her mom knows, and the daughter knows that they can trust me. And so the mom today, she said the cutest thing, and I need to remember this, but we were talking about my 6-year-old son and how the kids, you ask at the end of the day, what did you do today? Well, I don't know. I said, you don't know what you did today? No, we played. And I said, it's so funny to hear him interact. She said to me, and she reminded me, because he's a human being. He's being, he's not human doing. And I
Yeah.
said, wow, that's something I need to remember and resonate with. And so throughout the process, and also my practice of yoga, it's truly about making the most of the day and really being a part of the process. And sure, I have goals. Absolutely. We were writing our Q4 goals today, because we have to have structure, but also listening to what my patients need, what the community needs, what my son needs. And 5 years from now, that may be a whole different picture than what I'm envisioning. So continuing to help people, continuing to spread the word of direct primary care, pretty basic, remaining content with what I'm doing. And truly, I think the best answer is spreading this to other providers. Because what I've noticed, and my goal is to take care of patients, but also to take care of providers as well. Because the quality of life, and you mentioned earlier about the quality of life versus the quantity of life, and the quality of life, to see a nurse practitioner step into this role compared to a traditional healthcare system, and just them going, wait, this is an option? This is so cool. So
Yeah.
continuing to allow that to grow in the community, and continue to open practices if we, if that's what the community wants, that's what we'd like to deliver.
That's so awesome. And I would say the whole model that you guys have is about being
Mhm.
present, listening, really hearing what the patient
Thank you.
is talking about. So that's what I think is so beautiful. I have two more questions. One,
Sure.
sometimes we learn the most from our biggest failures.
Yes.
What has been one of the hardest but most gratifying lessons in your life?
Hardest, most gratifying lessons of my life. That is a great question. I think it is truly the ability to recognize your strengths, your weaknesses, your ability to set boundaries, And previously, and this goes back to the taking care of other medical providers, is learning boundaries. And previously, I'm such a yes person and I love people so much. I'm so passionate about it. I have a hard time saying no. And so, but who suffers when you don't say no? Everybody.
Yeah.
I suffer, my son suffers, you can hear me kind of hollering at my doodles. I have therapy dogs that work in the clinic with me. They suffer because then not everybody's getting your 100%. And so truly my failures have been my biggest successes in learning when to say no and when to delegate and recognizing other people's strengths that may be better at me and handing things off to them. And so that's been a huge transition with becoming an entrepreneur, is failing and then getting right back up and saying, all right, I'm going to change it and not keep doing it this way. Because
I,
obviously that doesn't work.
what do I say? Fail is a fierce attempt in learning. So you never fail.
Yes.
Even if you're failing, all it means is you're growing, right? Right.
Yes.
So that's beautiful. And lastly, this is called the Honor It All podcast. So what are you choosing to honor today?
I am choosing my family today. I am going to be heading over to my sister's house for a dinner with my family and honoring their support in everything that I've done, all of my dreams, my visions, being standing behind me through everything and really supporting me through all I've done and always being by my side. So I honor my family.
Wonderful. Well, it's been a great episode and I so appreciate you coming on. I want the audience to know that all of the information about Aquarian, they'll be in the notes. So wherever you're watching this, you'll be able to get in contact with Taylor and the clinic. And I would just highly encourage it. Check it out because you really don't even know what you're missing until you try it. So thank you so much. And
Thank you, Honor.
you're welcome. And remember to honor today. We are not promised tomorrow. And thank you so much for being here.
Thank you.
Take care.